लोग का टोटल 35 है ना, 16 ही 15 ही प्रेजेंट हुआ है, पता नहीं क्या हो गया इन लोग का। सेकेंड ईयर। Okay, good morning all. Oh, sorry, good afternoon all. Hello.
Good afternoon, ma'am.
Okay. So now come to the next part, that is qualities of a good counselor. So good counselor qualities for your easy remembrance, I have given in like this manner: GWD, good counselor. So G for good technical knowledge. The counselor who is giving counseling, he or she should have a good technical knowledge. Means how to give the counseling, he should understand. He should know all the technical things. Means what things he or she should see, how to give the counseling, what is the other person personality, what is his nature, how he is behaving, whether he is telling the truth or not telling the truth. By observing, he should understand. So he should have a good technical knowledge. Then O for obtaining appropriate information from the patient. So the counselor should have that capacity that he should obtain he should able to obtain, or he should able to take the appropriate, means the correct information from the client. Okay, means he should know whether the client is telling the truth or not, and or he should maintain such a good relationship with the client that the client should develop a trust over the counselor, and he should share his original, or the you can say the real feelings with the counselor. Then next O means objective answering questions. Okay, objective answering questions means suppose in first year you have in case care plan, you have come na objective data, subjective data. So can anyone you can tell me what do you mean by objective data? Anybody from the first year syllabus, what do you mean by objective data?
What we observe.
And yeah, so here means objectively answering questions means it should what you can, whether when the person, the client is answering something, you should observe the client, that whether he is really he's expressing his real feelings or not. That is objectively answering objectively answering questions. Means what you should ask such type of question, which the whatever the answer will given by the client, you should able to observe it. Means why you are being sad or why you are being happy, those things should be observable by the counselor. So that type of question should be asked. Then demonstrating professionalism. So while you are giving counseling, you should demonstrate the professionalism. So he should not take advantage of your caregiving nature, or you also should not, as a counselor also should not take the advantage of the client. So they should both should they should the client, the counselor should maintain the professionalism. See, he should be act professionally. He should not be involved like very much emotionally and like a family. He shouldn't maintain his professional dignity. Means when the time is given for counseling, he should maintain the time, maintain the decorum, maintain the privacy, everything he should be maintained according to his professionalism. Then next is C for confidentiality maintenance. So the counselor should able to maintain the confidence. Okay, during the counseling process, the client may share some of his very private information with the counselor. So the counselor should able to maintain that confidentiality, so that whatever is not needed to discuss in the public or with the other healthcare provider, he or she should not discuss with the other person. So that is called confidentiality maintenance. Next is observant. Observant means the counselor should observe the The counselor should observe the client, okay, while giving while he is sharing his experience or feelings with the counselor or any viewpoint. The counselor should observe properly that his body language also the counselor should observe. Next is unbiased. Unbiased means it should be the counselor should treat the person equally, okay, all the person he should treat them equally. It should not be that that person I like, so I will treat him nicely, the other person behavior I don't like, so I will not treat them nicely. So it should not be biased, it should be always unbiased, means he or she should the counselor should treat all his clients equally. He should give everyone equal importance. They're non-judgmental. The counselor should never be judgmental. Judgmental means the suppose in the other person is a smoker, okay, so the counselor should not be think that he is not a good person because he is having a bad habit, like that is a judgmental. On what condition he is taking the smoking, how he has started, without knowing this thing, the counselor should never become judgmental. He should only focus on that he should remove this addiction from his life. So the counselor should always be non-judgmental. He should not give any judgment or he should not be point the person shortcomings. He should not be judgmental. Then the sensitive to the need of the patient. Though the counselor should be sensitive to the need of the patient. According to the patient need, he should be sensitive. If the patient is very much depressed, he should show his sensitive nature to the patient and encourage him. Okay, if the client is very much aggressive in nature, he should according to the patient need, according to the client need, the counselor should show the sensitivity. He should sense it and he should behave calmly. So according to the need of the patient, the counselor should show his sensitive behavior. Then empathetic means empathetic word I have explained so many times. Okay, anybody can explain or tell what is the meaning of empathetic? Anyone? Empathetic? Yankee, what do you mean by empathetic? Last class also I explained empathetic nature. What do you mean by that? Dharitri, Bora, empathetic means what? Empathetic means?
Ma'am, share feelings to another.
Uh, to feel the other person feelings, okay, that is empathetic nature. As I think last class I have given an example that sometimes we start crying by seeing the hero or heroine crying in the movie. So that is our empathetic nature, means we can feel the pain of the other person, okay, that is called empathetic. So a counselor should be empathetic in his nature. Then listen carefully, that is it is one of the most important qualities of a good counselor. The counselor should listen each and everything shared by the client. Okay, whatever the client is saying, or even if he is not giving so much importance in saying few things, like his voice may be very low or very shallow, that thing also the counselor should listen properly, because sometimes when we cannot express something, and if we cannot sometimes what happen, if we cannot express a particular thing, we used to say that word very slowly or very in a very low tone. So those things also the counselor should listen everything, whatever thing, whatever small, important, not important, everything, whatever things are explained or shared by the um, the client, the counselor should listen everything very carefully. Okay, then L for let the patient make decisions. So already I explained in my previous classes, here you will not bound the patient to follow a certain decision. You will encourage the patient to take his own decision which will be benefited for the client. For example, as I told you, you can suppose I don't want to suppose a class 12 pass student, he is telling I don't know what career I should choose. So like a counselor, he should give some options. So you are good in this one, you have you have get good marks in history, so you can become this one, you just like that. He should give the options, and you should, in the counseling, the counselor should encourage the patient or the client to make his own decision, which will be in a long term benefit for the client itself. So here, the one of the qualities of a good counselor is he should encourage the patient to make his own decisions. Then O for open minded. So the counselor should not be very close minded. Okay, he should be open minded. Open minded means suppose according to our values, customs, okay, tradition, we have some, we our mind is restricted to some values or thinking. But the good counselor should be open minded. He should be a broad minded. He should not say that in he should not think that in our culture this has things has not been done, so if the other person is doing this one, he is a bad person or he is not a good person. So he should be open minded that okay, yeah, this person is doing this one that is according to their culture, so it may happen. So he should think the other person viewpoint broadly. He should take the other person viewpoint or other person information in a open minded way. Then R for respect of the right of the patient. So here also we should respect the patient right. Okay, or the client right. It's not that the client should only listen to us, only whatever we are giving information that is correct. The client also may share something which we don't know. He can share his own feelings. So we should respect, while talking with the patient, we should respect the patient right and patient information also. So these are the good qualities of a counselor. Understood?
Yes, ma'am.
Okay. Then, mm, so difference between health education and counseling. Okay, so this one already I told you, but one more time I can tell you that in counseling is very confidential. Okay, the one person or the persons we can give counseling with the person's relatives who is with whom the client can share his own information. So it is a very confidential process. We cannot share the information or tell the client in front of the other person who are not related to the patient. So it is, counseling is a very confidential process. Then the health education is not confidential. We can tell whatever health education with, we can share the same health education within a very large group or within a very unknown persons also. It is not confidential, because as you have given the health education, you have seen we can, each person may know don't know the other person, so, but together we can give the health education, so it is non confidential. Number two is one to one process or a small group. So the counseling is a process where one person is with can come contact with the other person. Okay, or with a very small group. Means small group, suppose the wife is having problem with her husband, so there both husband and wife can be included in the counseling process, where that's a very small group. But health education can be a very large group. For a group of various people, various a large amount of people, or large number of people, we can give the health education. Then in counseling is focus specific and goal directed. Okay, the counseling is, as I told you, it is very specific. Means if the person is having problem in his study, so that should be only the counseling process will be only focus on this study process, not how he should adjust, and all those things are not included. It is only goal directed that how he can adjust with his study. But in health education can be generalized. Okay, it can be generalized. It is not like that we cannot means health education. Suppose a person is having breastfeeding, so we can give the breastfeeding to all the people, all the women. We can even give to the how to give, even the we can give health education how to give breast, how to feed the baby, why breastfeeding is important, when should be given, how much to be given, everything we can share in the health education. But that is generalized, but the counseling process is only specific. Then number 4 is felicitate change in attitude and motivates behavior change. So it's give importance in changing in attitude and motivate behavior change. But in health education, information are being given to increase the patient, increase the group knowledge. Okay. Then number 5 is counseling is always problem oriented. It is based, counseling is given based on the problem. Okay. It is counseling is always given on the based on the problem. But the health education is based on the content. It is not given on the problem. So like how to take care of self in home, okay, after discharging from hospital. That is not a specific, not a problem, it is a content oriented. Okay, but the problem is in counseling, like how to adjust with this person, how to adjust in hostel. It is focused on or a problem, what is the problem faced by the client. So number 6 is based on needs of the client. So counseling is based on the need of a specific client. One person is different from other person. Each person is having different. I suppose I may be having different problem. You person as like Vijeta is having, may have different problem. Then Aisha may have different problem. So it is based on the need of the each client. But health education is basically need on the public health. Okay, public health means like in a gynae ward. In a gynae ward, we never give health education on hypertension. We mainly give health education on how to how to care of a pregnant mother, how to care of a baby, what is the importance of breast milk. We give awareness about those. So it is based on the public health need, what the public need. Okay, so these are the main difference between counseling and health education. Come to the next. So role of the counselor. So arrange orientation program for the other support staff to enlist their cooperation. So that is one of the role. They should arrange the orientation program. Okay. Then prepare an up-to-date list of resources, information and referral and energy available to him. So they should make an up-to-date list of resources. What are resources are being are available? What are the information he knows? What referral he can give? So what referral can give, what energies are there to give a counseling process, this should be prepared. Then organize the guidance committee. He should organize the who person will guide. Okay, the committee he should make. Then set up an educational and occupational information center. So he should set up one educational and occupational. Education means based on the education, occupation means on which occupation the client will go. So it should be based, it should set up an education occupational information center, then display the information collected in an attractive way. Whatever the information are being collected, it should be display, means shown in an attractive way, so that the person themselves, he or she can come to get the counseling. These things are, this role of the counselor is mainly focused on education. Okay, for the education seminar or education counseling, this is mainly focused on this role. Then disseminate information through educational and career talks, group discussion and so on. So they should be give the information through career talks means in movie, I think in news channels sometimes we give the career talks, which careers are more opportunity, why they should go through that career, what things are needed for this career, what subjects are needed in class 10 plus 2 is needed. This career talks, they should give the information. Then group discussion, among few groups they should discuss, and so on. Then arrange talks by expert from different field. So okay, from different in career counseling from different field, like medical field, nursing field, engineering field, other technological field. So the expert who knows their field very well, they should come and talk. Then organize career days, career weeks, career conferences, parents day, and so on. A counselor and educational counselor should organize career days, career weeks, like they should discuss about some specific career conferences, what career uh, what career are nowadays are more getting more jobs. Then parents, they can discuss with the parents that what are the interests of their child, and according to they should, so that they should go in a career. So these things are the role of the counselor. Then come to the role of the nurse. The what is the role of the nurse? It is these things you have learned in the first year itself. Role of the nurse, they are like coordinator. They can be coordinate. Okay, they can be coordinated. Then communicator. They are communicator, means one communicator between one person to another person. They can, their role is a teacher also, they can teach also. It's a counselor role also, manager role also, they manage. Okay, then leader also, in some situation the nurses are the leaders. Then team player, then motivator, delegator, critical thinker. Critical thinker is mainly important. This critical thinker role is mainly played in the ICU, in critical care giving. Then innovator, then researcher, then research you have to do no, in fourth year. Then advocate. All these things are the role of the nurse. These things details you have already learned in first year. Then issues of counseling in nursing. So number one is scarcity of qualified and competent counselor. So there is a scarcity of qualified or competent counselor. Okay, qualified people are very less in nursing field. So there are always scarcities there. Then lack of awareness about need and resources of counseling. So awareness is very low. So about the why the counseling process is needed, and the why the resources are also very less for the counseling. So there is a there is a lack of awareness. Okay, then minimal pro counseling environment. So the counseling environment is not very minimal in this nursing field. So that is also one of the issue. The lack of counseling training for nurses or nursing faculty. So anyway, the counseling training are not given to the nursing or nursing faculties. So there may issue of counseling in nursing. Then poor organizational setup for counseling service. The organization setup are not there for counseling services. The lack of interest and initiative for counseling services. So many nurses are not interested in giving counseling, so there is a lack of interest. Then poor counselor ratio. So here, the as we know, the nurse patient ratio, nurse client ratio is not good. So actually it should be 1:1 or 1:2, but the ratio is not proportional, like 1:10, 1:20. This type of ratios are there. So the counseling ratio is very poor. Lack of funds for counseling service. So funds are not there, money problem is there. Non-compliance with counseling interventions. Okay, then non-compliance means they will not follow what are the counseling interventions may come out, what are the means steps to be taken after the counseling process. These are not done by the not are done by the client. Then ethical and moral issues are also one of the main issues in counseling in nursing. So these are the issues. Okay, it's also very important. Then managing disciplinary problems. So what are the disciplinary problems? So common disciplinary problems seen in Indian students are absenteeism. So people are mostly absent. So in this class also, out of 35, only 19 are present. Most of your classmates are absent. So absenteeism is one of the problem. Then non-submission or late submission of assignment. You know, this one is very better than me. Whenever somebody tell you to submit any assignments, you are always late. You never submit the assignments on time. Then disturbed classroom is atmosphere. So many colleges are there in the just near the roadside where traffics are going. The sounds, so many sounds, sound disturbance is there. So this is also atmospheric disturbances. Then threatening strike. This is one of the disciplinary problem. Okay, threatening they used to give. Then damaging or spoiling institutional property. Students are damaging the bench decks, breaking the lights, the windows. These are the disciplinary problems. Then picking quarrels over small matters. You student sometimes the students fights over very small thing that person has told me this one. You start fighting. So this is also a disciplinary problem. Then using mobile phone in the classroom and so on. So now though the situation itself is we are bound to use mobile phone, but before students are using mobile phones in the classroom, in the clinic also they should take the mobile phone. So these are the disciplinary problems which are coming in, which are mostly seen in the Indian students. Okay, so you have to these are the managing, we have to manage this thing like absenteeism. So if you so that's why the Indian Nursing Council has a strict rule that who are not absent, they means that there is a specific attendance ratio for sitting in the examination. So that is one of the steps are being taken. Then late submission also, teachers are reducing your marks. I think now you have come to know because of absenteeism, two students are 6 months back, they have got 6 months back. Then late submission, because of late submission, few students you have got very less marks in internal assessment. So these things can be managed. Okay, like like damaging or spoiling institutional property. For this one, that's why management has taken one fees in the beginning of the course, 10,000, isn't it? Do you remember? 10,000 has been taken by the management.
Yes, ma'am.
If you have not spoiled anything or not damaged any property, then they will return it to you. But if you have during your study time you have damaged any property, they will not return the money. So these are the these are the ways like to manage the disciplinary problem. They can picking quarrels over small matters. So in schools and all, they are giving punishment to the students who are quarreling, and using mobile phone in the classroom and so on. Like for this regard, the teacher is to take the mobile phone as a punishment for 1 month, or sometimes the mobile phone itself not returned to the student, because these are the managing steps which are taken to resolve the disciplinary problems. Understood, na? So 9 minutes are left. So strategies for management of disciplinary problems. So what are the strategies are taken? Like appropriate training of faculties and teachers, adequate practice of co-curricular and extracurricular activities. So that to reduce your addiction of mobile phone previously, that selfie competition, all these co-curricular, extracurricular activities are being conducted, so that you get the time to engage with your mobile also. Like appropriate selection and use of disciplinary standard, use reward and punishment. So as earlier has been told to you, na, for good behavior, for proper uniform maintenance, one reward point, 5 mark extra point will be given. So this mark has been included in your internal assessment. Then promoting better teacher-student relationship, cultivation of ethical and moral and spiritual values, A close teacher-parent-student contact should be maintained, and effective use of guidance and counseling programs should be organized in the school colleges for the management of disciplinary problems. So these are the strategies for management of disciplinary problems. Understood, everyone? Hello?
Yes, ma'am.
Understood.
Attendance level. Okay, all of you on your video and give your attendance. One by one. Roll number 1 is Aisha. On your video.
Yes, ma'am.
Okay, 1 is present. Number 2. Who is 2? 2. Who is 2?
The two is lesson, ma'am. Bore per me.
Where is? She's absent, na? 3. 3.
Present, ma'am. Present, ma'am.
Your name?
Deepi Kulsum.
DP Kulsum. Okay. 3. 4. 4.
Present.
5.
Present, ma'am.
6.
Present, ma'am.
7. 8.
Present, ma'am.
9.
Present, ma'am.
10.
Present, ma'am.
Present, ma'am.
10. 2 present. Who is 10?
Present, ma'am.
11.
Present, ma'am.
Who is 11? 11. Name, please.
11.
Who is 11?
Nargis, ma'am. Nargis Sultan Ashok.
12.
Present, ma'am.
13.
Yes, ma'am.
14. 14. 15. 16. 17.
Present, ma'am.
18.
Present, ma'am.
19.
Present, ma'am.
20. 21.
Present, ma'am.
22. 23. 24.
Present, ma'am.
24.
Present, ma'am.
Who is 24?
Ma'am Yankee.
25. 26. 27.
Present, ma'am.
28. 29. 30. 31. 32. 33.
Present, ma'am.
34.
Present, ma'am.
34. 35. 36. 37. Okay. Okay, thank you all of you.
Thank you, ma'am. Thank you, ma'am.
If you have
Thank
any
you, ma'am.
question, you can ask me.
Thank
Okay?
you, ma'am.
Okay,
Okay,
thank
ma'am.
you.
Ma'am, 24 present.
Yeah, I have given present. Thank you.